Have you ever found yourself stumbling for no reason, reaching for the wall as a safety net, or wondering why your footing doesn't feel as steady as it used to? If you're over 60, this isn't just old age, it's your body trying to send you a message. Every year, millions of older adults suffer falls that can be life-changing or even fatal, and the most terrifying part: most of these falls were preventable. In this video, we'll uncover the 5 often overlooked reasons why you might be losing your balance, and most importantly, what you can do about it today. If you care about your independence, mobility, and peace of mind, keep watching. This could change how you move and live forever. Muscle loss and weak core stability. As we age, one of the most silent yet most significant changes in our bodies is the gradual loss of muscle mass, a condition medically known as sarcopenia. This process often begins subtly in our 30s but accelerates dramatically after the age of 60. For seniors, the implications are more than just cosmetic. The decline in muscle strength, especially in the lower body and the core, has a direct and dangerous impact on balance. Your core isn't just about having a flat stomach, it's a complex system of muscles that stabilize the spine, pelvis, and shoulders, giving you the support needed to walk, sit, stand, and move without falling. Weakness in these areas means that everyday movements, like standing up from a chair, turning around in the kitchen, or stepping out of the shower, suddenly become riskier, with a higher chance of slipping or misstepping. Unfortunately, most people don't realize how crucial these muscles are until they experience a fall or near miss. Studies show that adults lose as much as 3 to 5% of their muscle mass per decade after 30, and the decline can be more pronounced if you're not physically active. Even worse, this loss of muscle doesn't just affect strength, it affects reaction time. If you trip, your body's ability to catch itself with a quick step or arm movement becomes significantly compromised. This is why seniors often find themselves on the ground before they even realize what happened. Another overlooked factor is posture. As core muscles weaken, posture deteriorates, leading to a forward-leaning gait that shifts your center of gravity ahead of your feet. This not only makes you more prone to falling but also increases the likelihood of spinal compression and hip fractures in the event of a fall. Core stability is also intricately tied to breathing and coordination. The diaphragm, which helps control your breath, works in tandem with deep abdominal and back muscles to stabilize your torso. As these muscles weaken, even your ability to breathe efficiently and stay coordinated during movement can falter. That's why some seniors find themselves short of breath with minor exertion or feeling off balance after bending down. Compounding this issue is inactivity. Retirement, reduced social outings, and fear of injury often cause people to become more sedentary, which speeds up muscle atrophy and further reduces core function. It becomes a vicious cycle. You move less, so you lose more strength, which makes you less stable, which makes you move even less. The good news is that muscle loss isn't irreversible. Resistance training, especially exercises targeting the core, can dramatically improve stability. A 12-week study conducted by the Journal of Geriatric Physical Therapy found that seniors who engaged in just 3 sessions a week of core and leg strengthening exercises improved their balance scores by up to 35%. The most effective movements are surprisingly simple: standing leg lifts, pelvic tilts, seated knee extensions, and even using resistance bands while seated can begin to restore core control. Tai Chi, yoga, and water aerobics have also been shown to enhance muscle coordination and boost overall balance confidence. These activities don't just build strength, they reprogram your neuromuscular system, enhancing your brain's ability to communicate quickly with your muscles during sudden shifts or unexpected slips. Beyond exercise, nutrition plays a key role in preserving muscle integrity. Adequate protein intake, especially leucine-rich sources like eggs, fish, and legumes, is essential to fuel muscle repair and regeneration. Seniors often consume less protein than their bodies need, especially those who live alone or eat smaller meals. Vitamin D deficiency is another silent contributor. It weakens muscles and bones simultaneously, leading to a double-hit effect on balance. Supplementing with vitamin D3 and calcium, under medical guidance, can significantly reduce fall risk. Don't underestimate hydration either. Dehydration reduces blood volume, causes dizziness, and affects muscle function, particularly in warmer months or after taking diuretics. It's also critical to get a functional movement assessment, ideally with a physical therapist. Many clinics offer senior-specific balance and gait screenings that identify weaknesses you might not be aware of. These evaluations can detect imbalances in muscle engagement between the left and right sides of the body, which often go unnoticed but can drastically impair walking and stability. Addressing these imbalances with targeted exercises can be a game changer, especially for those who've already experienced a fall. In many cases, improving core strength not only enhances balance but restores confidence, leading to better mobility, more independence, and a higher quality of life. Because the truth is, balance isn't just a physical issue, it's deeply emotional. The fear of falling can keep seniors trapped in their homes, anxious about walking to the mailbox or climbing stairs. But by confronting the root cause, muscle weakness, and actively rebuilding strength, that fear can be replaced with empowerment. Vision and depth perception decline. One of the most underappreciated factors contributing to balance loss after 60 is the gradual, almost invisible decline in vision and depth perception. While most people associate sight with reading, driving, or recognizing faces, its role in physical balance is profound. Your eyes are your body's internal GPS, constantly taking in cues from the environment, adjusting your posture in real time, and helping you navigate the world with precision. When vision begins to deteriorate, the brain receives less accurate information about the body's position relative to its surroundings. This distortion, even if minor, can disrupt the delicate coordination between your eyes, brain, and muscles, making you more prone to tripping over small obstacles, misjudging steps, or losing your footing entirely. As we age, several changes in eye function occur simultaneously. The lenses of the eyes become less flexible, making it harder to adjust focus quickly, particularly in low-light conditions or when switching between distances. The pupils shrink and become less responsive to changes in lighting, which can make sudden transitions, such as moving from a bright room into a dim hallway, disorienting. Additionally, the retina becomes less sensitive to contrast and motion, meaning the brain struggles to detect movement or changes in terrain, such as a curb, an uneven sidewalk, or a carpet edge. Even basic tasks like descending stairs or stepping into a bathtub become dramatically more dangerous when these visual cues are compromised. Beyond general visual decline, specific eye conditions common in older adults further amplify the risk. Cataracts cloud the lens, creating a foggy, blurry view that diffuses light and washes out depth cues. Macular degeneration affects the central field of vision, which is crucial for focusing on what's directly ahead, like a chair you're about to sit on or a step you're trying to land on. Glaucoma, which affects peripheral vision, can prevent you from noticing hazards out of the corner of your eye, like a coffee table leg or a stray shoe. Diabetic retinopathy, caused by damage to the blood vessels in the retina, can lead to fluctuating vision and blind spots that come and go without warning. These conditions not only affect clarity but also disturb the constant feedback loop between sight and stability. The danger compounds when visual decline goes unnoticed or unacknowledged. Many seniors adapt subconsciously, using furniture or walls for support or walking more slowly without fully understanding why they feel off. In fact, some chalk up minor stumbles to clumsiness or aging, not realizing their eyes may be the real culprit. Unfortunately, standard eye exams don't always assess depth perception, contrast sensitivity, or motion tracking, all critical components of balance. That's why a comprehensive vision evaluation from an optometrist or ophthalmologist who understands geriatric care is essential. These professionals can detect functional impairments before they lead to a fall and recommend corrective strategies that go far beyond eyeglasses. For some, the fix might be as simple as updating a prescription, getting anti-glare lenses, or using bifocals with proper adjustments. For others, cataract surgery or treatment for an underlying condition may dramatically improve visual input and stability. But corrective actions go beyond the eyes themselves. Proper home lighting plays a major role in balance safety. Soft, ambient light may feel cozy, but it's often inadequate for a senior who needs strong, shadow-free illumination to navigate confidently. Installing motion sensor lights in hallways, adding under-cabinet lighting in kitchens, and using high-contrast color cues on stairs or bathroom thresholds can prevent the kind of visual ambiguity that leads to falls. Technology, too, offers useful tools. Apps that train visual acuity, contrast sensitivity, and eye-hand coordination are emerging as practical ways to boost neural pathways involved in sight and balance. Virtual reality programs designed for seniors now incorporate visual exercises that improve spatial awareness and reaction time. These interventions don't just support vision. They retrain the brain to interpret and respond to visual data more efficiently, restoring confidence with every step. Meanwhile, strategies like keeping floors clutter-free, avoiding patterned rugs that distort depth cues, and using color-contrasted footwear can offer immediate help. Diet also influences vision more than many people realize. Nutrients like lutein and zeaxanthin, found in leafy greens, eggs, and brightly colored fruits, help protect retinal tissue and support macular health. Omega-3 fatty acids reduce inflammation in the eyes, while vitamin A is crucial for low-light vision. Supplementing with eye-friendly nutrients under medical guidance may enhance visual function and delay the progression of degenerative eye diseases. Hydration is also key. Dry eyes reduce visual sharpness and increase light sensitivity, both of which can undermine safe movement. Ultimately, your eyes are not just windows to the world, they're critical to keeping you upright, safe, and independent. Ignoring changes in vision can have a domino effect that impacts every area of daily life, from the ability to enjoy walks to safely climbing stairs. Recognizing the role of visual decline in balance issues is the first step toward prevention. Whether it's regular screenings, improved home lighting, or targeted nutrition, small changes can preserve your sight and your stability. Because staying upright isn't just about strong legs or good shoes, it's also about seeing clearly where you're going and having the confidence that your body and brain are reading the same map. Inner ear and vestibular system dysfunction. Deep inside the inner workings of your ears lies a powerful system you've probably never thought about, the vestibular system. This complex network of tiny canals, fluid-filled chambers, and nerve receptors doesn't help you hear, it helps you stand. It's responsible for detecting head movements, body orientation, and maintaining equilibrium, even when you close your eyes or walk in the dark. After 60, this vital system often begins to deteriorate. The result? Dizziness, disorientation, unsteadiness, and a higher likelihood of falls. What makes it especially dangerous is that this decline often goes unnoticed until a person experiences a severe vertigo episode or unexpectedly collapses from a sudden loss of balance. This isn't simply about getting older. It's about the aging of a system that keeps your body aligned with gravity itself. Inside each ear is a set of semicircular canals filled with fluid and lined with fine hair cells. These respond to movement, helping your brain understand which way your head is turning or tilting. In addition, structures called otolith organs detect linear acceleration, such as when you move forward, backward, or up and down. As you age, the number of these hair cells declines, the nerve signals weaken, and the structures become less responsive. Your brain starts receiving distorted messages about motion and position, and this internal confusion can manifest in many subtle ways. Feeling off balance on flat ground, swaying when standing still, or getting disoriented after turning your head quickly. For many seniors, these sensations become so common that they start avoiding activities like walking outdoors, climbing stairs, or attending crowded events, not because of fear alone, but because their sense of stability has fundamentally changed. The vestibular system also works closely with your visual system and proprioception, your body's sense of its position in space. When one of these systems weakens, the others try to compensate. But if two or more decline at the same time, the brain struggles to integrate the mixed signals, leading to a phenomenon called sensory mismatch. This is why older adults often feel dizzy when stepping onto an escalator, riding in a car, or walking on uneven terrain. Even something as simple as turning your head while walking can throw off your balance if your vestibular reflexes have dulled. One of the most common culprits is benign paroxysmal positional vertigo, BPPV, a condition in which tiny calcium crystals in the ear become dislodged and interfere with balance signals. It causes sudden bouts of spinning sensations, usually triggered by movements like lying down, looking up, or rolling over in bed. BPPV is especially common in seniors and is treatable, but only if it's properly diagnosed. Unfortunately, many people mistake vestibular problems for general aging or cardiovascular issues, and they go untreated. This leads to increased fall risk, limited mobility, and a sharp decline in quality of life. What makes vestibular dysfunction even more treacherous is its unpredictability. Some days, a person might feel perfectly stable, while on others, they're overwhelmed by disorientation or fatigue simply from walking across a room. Chronic vestibular dysfunction can also impact mood and cognition. When your body feels unstable, the brain interprets it as a threat, activating stress responses that increase anxiety and fatigue. Over time, this can spiral into a cycle of inactivity, depression, and worsening symptoms, especially in individuals who don't understand what's happening or how to seek help. Thankfully, there are highly effective treatments and strategies available. Vestibular rehabilitation therapy, VRT, is a specialized form of physical therapy that uses head, eye, and body exercises to retrain the brain's response to movement. Research shows that VRT can reduce dizziness, improve stability, and help seniors return to normal activity levels. These exercises often include repeated movements designed to desensitize the vestibular system to certain triggers, strengthen the neck and core, and improve the body's ability to respond to balance challenges. In many cases, improvements are seen in just a few weeks. For those with BPPV, maneuvers like the Epley procedure, which can be done in a clinical setting, can realign the displaced crystals and eliminate vertigo almost instantly. There are also steps you can take at home. Practicing slow head movements while standing near a wall, walking in a straight line with eyes open and closed, or balancing on one foot for a few seconds at a time can all help maintain vestibular function. Avoiding sudden position changes, staying hydrated, and managing blood pressure are also crucial, as inner ear function is closely tied to circulation. Dehydration or fluctuations in blood flow can aggravate dizziness and instability, so drinking water throughout the day and avoiding rapid postural changes are simple but effective habits. Also, avoid environments that can overload the senses, like flashing lights, loud sounds, or visually chaotic areas, as they can overwhelm a weakened vestibular system and lead to nausea or balance loss. Hearing loss is often linked to vestibular decline, and addressing one can sometimes help the other. Regular hearing checkups, especially for those over 60, can lead to early identification of inner ear issues. Devices like hearing aids, when properly fitted, can improve spatial awareness and auditory cues that also assist with balance. Finally, don't ignore your instincts. If you've started feeling unsteady, even slightly, or have noticed that you avoid looking up, turning quickly, or walking in dim light, it may be time to get evaluated. Early detection and intervention can prevent falls, preserve independence, and bring a sense of control back into your life. Balance isn't just a physical act, it's a whole-body conversation involving your brain, eyes, muscles, and inner ear. When the vestibular system begins to falter, the harmony of that conversation breaks down. But with awareness, targeted therapy, and consistent care, you can restore that inner harmony, reclaim your confidence, and keep moving forward with steadiness and strength. Medication side effects that impact balance. In the quest to manage chronic illnesses, many seniors find themselves juggling a complex array of medications. While these prescriptions can be life-saving, they often come with side effects that quietly undermine one of the most crucial elements of safe aging, balance. The human body is an incredibly fine-tuned system, and when multiple drugs interact or affect the central nervous system, even slightly, the result can be dizziness, lightheadedness, blurred vision, muscle weakness, and impaired coordination. For those over 60, these subtle shifts can be catastrophic. In fact, the Centers for Disease Control and Prevention, CDC, reports that medication-related falls are one of the leading causes of injury among older adults, often leading to hip fractures, hospitalizations, and long-term loss of independence. The risk increases exponentially with a phenomenon called polypharmacy, taking 5 or more medications daily. This is common among seniors managing conditions like hypertension, arthritis, diabetes, insomnia, or depression. Each medication may seem harmless on its own, but together, they can produce cumulative effects that compromise the body's balance system. For example, many blood pressure medications, such as beta blockers or diuretics, lower blood pressure so effectively that they can cause orthostatic hypertension, a sudden drop in blood pressure upon standing. This leads to dizziness or fainting, especially first thing in the morning or after sitting for long periods. Add in a mild sedative for sleep or an antidepressant that affects neurotransmitters, and the body becomes sluggish and delayed in responding to sudden changes in posture or movement. Medications that affect the brain's chemistry are particularly concerning. Benzodiazepines, often prescribed for anxiety or insomnia, are notorious for causing drowsiness, delayed reflexes, and confusion, particularly in older adults whose liver and kidneys process drugs more slowly. Sleep aids, both prescription and over-the-counter, can leave behind a hangover effect that impairs daytime function. Antidepressants, especially tricyclics and SSRIs, can interfere with coordination, cause tremors, or alter alertness. Antihistamines, commonly taken for allergies, often have a sedative component that dulls sensory input and reaction time. Even painkillers, especially opioids, reduce central nervous system activity, leading to unsteadiness and foggy thinking, a dangerous combination when navigating stairs or walking on uneven ground. What makes the problem even more insidious is that many seniors and caregivers don't associate these side effects with medication. Instead, they attribute the dizziness or imbalance to just getting older, never questioning whether a pill taken every night might be affecting their gait during the day. Doctors, pressed for time, may not always inquire about balance changes, and pharmacists may not be aware of all the medications a person is taking, particularly if prescriptions come from multiple specialists. This communication gap can delay recognition of harmful drug interactions and their impact on equilibrium. Another layer of complexity comes from medications that affect sensory systems. Some antibiotics, such as gentamicin, are ototoxic, meaning they can damage the inner ear and vestibular system, leading to permanent balance issues. Chemotherapy drugs, which may be prescribed to seniors with cancer, can cause peripheral neuropathy or sudden drops in blood pressure. Certain anticonvulsants and antiarrhythmics can disrupt coordination and cause involuntary movements. Even drugs considered benign, like statins or antacids, can interfere with nutrient absorption, specifically magnesium, calcium, and vitamin D, all essential for muscle and nerve function. The result is a slow erosion of the body's stability from multiple angles, none of which are immediately obvious. But there is hope and action you can take. The first step is to regularly review your medication list with your primary care provider or a geriatric pharmacist. This should include not just prescription drugs, but also over-the-counter supplements, vitamins, herbal remedies, and eye drops, all of which can contribute to balance issues. A medication reconciliation session can reveal redundancies, unsafe combinations, or drugs that are no longer necessary. In many cases, dosages can be adjusted, medications can be substituted with safer alternatives, or a gradual tapering plan can be introduced to minimize side effects. In fact, studies show that even small changes in a senior's medication regimen can result in significant improvements in stability and cognitive clarity within just a few weeks. It's also essential to monitor when and how medications are taken. Some drugs should be taken with food to avoid blood sugar spikes or drops. Others should be spaced out throughout the day to reduce cumulative sedation. Setting alarms, using pill organizers, and keeping a written log can help ensure medications are taken correctly and consistently, reducing the likelihood of side effects. Keeping hydrated is another key factor, as many drugs dehydrate the body or alter electrolyte balance, further impairing balance control. Seniors should also be cautious when starting new medications. The first few days are often when side effects like dizziness or blurred vision are most pronounced. During this time, avoid driving, use handrails, and move slowly from lying to standing positions. Ultimately, managing medications is not just about treating illness, it's about protecting your freedom to move safely through life. Every pill has the potential to shift how your body balances itself, and being proactive about those choices can mean the difference between staying independent or becoming vulnerable to injury. Balance isn't just physical, it's pharmacological. Understanding the hidden influence of medications, questioning their necessity, and working closely with healthcare professionals can empower you to stay upright, alert, and confident, one step at a time. Neuropathy and diminished foot sensation. One of the most overlooked but critically important contributors to balance loss in seniors is peripheral neuropathy, a condition that disrupts the communication between the brain and the nerves in the feet and legs. As we age, the risk of developing neuropathy increases, particularly for those with diabetes, autoimmune disorders, or a history of certain medications like chemotherapy drugs. In simple terms, neuropathy dulls or distorts the ability of your feet to feel the ground. Imagine trying to walk on a tightrope blindfolded. That's what your nervous system experiences when nerve endings in your feet can no longer reliably report back on pressure, position, texture, or pain. Without this feedback, your body struggles to make the micro-adjustments necessary to keep you upright, especially on uneven surfaces, when turning corners, or during moments of distraction. For many seniors, the symptoms start subtly: a tingling sensation in the toes, occasional numbness, or a pins and needles feeling that comes and goes. Over time, these signs can progress into complete loss of sensation, making it hard to tell where your feet are in space or how firmly they're contacting the ground. This condition is especially dangerous because it creates a false sense of security. If you can't feel your foot slipping on a tile floor or recognize that you're stepping awkwardly on a gravel path, your body won't trigger the appropriate reflexes to recover your balance. The result is a higher risk of falls, not just in obvious situations like climbing stairs, but during routine tasks such as walking through your home, getting out of bed, or turning to reach for something on a counter. The most common cause of peripheral neuropathy in older adults is diabetes. Chronically high blood sugar damages the small blood vessels that supply nerves, especially those farthest from the spine, like the feet and hands. According to the American Diabetes Association, over half of all people with diabetes will experience some form of nerve damage, and the risk increases significantly with age. But diabetes isn't the only cause. Vitamin B12 deficiency, which becomes more common after 60 due to changes in digestion and absorption, can lead to nerve demyelination, essentially stripping nerves of their protective coating and reducing signal speed and clarity. Alcohol abuse, infections like shingles, and conditions such as hyperthyroidism or rheumatoid arthritis can also contribute to neuropathy. In some cases, the cause remains unknown, and it's classified as idiopathic, but the symptoms and dangers are no less real. Diminished foot sensation doesn't just affect stability, it alters how you walk. Seniors with neuropathy often develop a high-stepping gait, lifting their feet unusually high to compensate for the lack of feedback. This unnatural walking style not only tires the muscles more quickly but also increases the chance of tripping. Over time, the brain adapts to the loss of sensation by shifting the reliance onto visual and vestibular systems for balance, but if those are also compromised, as they often are with aging, the combination can be catastrophic. Even shoes become a hazard. Without feeling, you may not notice if your shoes are too tight, poorly balanced, or lack traction, all of which can exacerbate instability. Many falls occur because of something as small as stepping on a wrinkle in a rug or misjudging the slope of a driveway, moments where healthy nerve feedback would normally step in to correct the body's position. Fortunately, there are steps you can take to manage and reduce the impact of neuropathy on your balance. The first is accurate diagnosis. If you've noticed numbness, tingling, or unexplained balance issues, a neurologist or podiatrist can perform nerve conduction studies or use monofilament testing to assess sensation in your feet. Once identified, treatment focuses on controlling the underlying cause. For diabetics, this means rigorous blood sugar control. For those with vitamin deficiencies, targeted supplementation can restore nerve health over time. Certain medications like gabapentin or duloxetine may be prescribed to manage nerve pain, although they do not restore sensation and can sometimes introduce side effects of their own. Physical therapy is often the most empowering strategy. Balance training, gait retraining, and strength-building exercises help compensate for sensory loss by improving muscle responsiveness and coordination. Tactile stimulation, like walking on textured surfaces or using balance boards, can retrain the brain to make better use of limited sensory input. Orthopedic shoes or insoles with built-in feedback features, like textured liners or vibrating sensors, are also being developed to give real-time cues to help users adjust their posture and steps. Some seniors benefit from walking poles, which add additional points of contact with the ground and reduce the reliance on foot sensation alone. Home safety is another essential element. Remove loose rugs, add grab bars in bathrooms, improve lighting, and ensure that high-traffic areas remain clutter-free. If you live alone, Consider a fall detection device or medical alert system to ensure you can get help if something goes wrong. Regular foot checks are also crucial. Since neuropathy masks injuries, it's easy to overlook blisters, sores, or pressure points that can become infected or lead to more serious issues. Daily foot inspections, moisturizing to prevent cracking, and proper nail care can prevent complications that might further limit mobility or require hospitalization. Ultimately, neuropathy may steal some of your body's natural sensors, but with the right awareness, tools, and actions, you don't have to surrender your balance or independence. The key is vigilance, paying attention to how your feet feel, how you walk, and how your body responds to the surfaces around you. While the loss of sensation may be silent, its effects don't have to be. With early intervention, lifestyle adaptations, and the support of knowledgeable professionals, you can regain control over your steps and continue moving forward with confidence and clarity. How to rebuild and maintain balance after 60. By the time you reach your 60s, balance isn't just about staying upright, it's about preserving independence, preventing injury, and maintaining the confidence to move freely through the world. Fortunately, while aging may naturally introduce challenges to your stability, there is powerful evidence that balance can be rebuilt and maintained well into later years. In fact, the human body retains an impressive capacity to adapt, retrain, and strengthen itself when given the right tools and attention. The path to better balance isn't a mystery. It's a set of proven, practical steps that anyone can begin implementing today, regardless of their current fitness level. What matters most is consistency, self-awareness, and the willingness to take proactive control of your physical well-being. The foundation of any balance improvement plan is exercise. But not just any exercise. Targeted movement routines that focus on strength, coordination, flexibility, and proprioception can significantly enhance stability. Strength training, especially for the legs, hips, and core, is essential. Squats using a chair, heel raises at the kitchen counter, and resistance band exercises for the glutes and thighs help build the muscular foundation needed for confident movement. Just as important is dynamic balance training. Activities that challenge your equilibrium, such as standing on one foot, walking heel-to-toe in a straight line, or practicing sidestepping drills. These exercises teach your brain and body to react quickly and efficiently to unexpected changes in position or terrain. Tai Chi, often described as meditation in motion, has been widely studied for its ability to improve balance in older adults. Its slow, flowing movements promote control, spatial awareness, and postural alignment, all critical for fall prevention. According to a meta-analysis published in the Journal of the American Geriatric Society, seniors who practiced Tai Chi regularly reduced their fall risk by over 30%. Yoga also offers tremendous benefits, especially when adapted for seniors. It improves flexibility, strengthens stabilizing muscles, and enhances breathing control, which in turn supports core function. For those with limited mobility, chair yoga or aquatic exercise classes provide a safe entry point into regular movement without placing excessive strain on joints or weak muscles. However, improving balance isn't solely a physical endeavor, it's also deeply neurological. Your brain plays a critical role in integrating sensory input from your eyes, ears, muscles, and joints. As such, exercises that train the brain's coordination with the body are vital. Dual task training, which involves performing cognitive tasks while moving, like walking while reciting the days of the week backward, has been shown to improve the brain's ability to manage complex motor functions. Balance boards, wobble cushions, and virtual reality systems are also being used in physical therapy clinics and senior fitness programs to create safe but challenging environments that encourage neural adaptation. These tools help restore the body's ability to anticipate and respond to balance threats, the very skill that often diminishes with age. Nutrition, too, plays a fundamental role in supporting balance. Protein intake is crucial for muscle repair and strength maintenance. Seniors should aim for 1 to 1.2 grams of protein per kilogram of body weight daily, spread evenly across meals. Micronutrients like vitamin D, magnesium, calcium, and B vitamins all support bone health, nerve function, and energy metabolism. Hydration is another cornerstone. Even mild dehydration can lead to dizziness, confusion, and impaired coordination. Seniors often experience a blunted thirst response, so intentional water intake, not just drinking when thirsty, is vital. Limit alcohol, as it impairs coordination and reaction time, and be cautious with caffeinated beverages, which can act as diuretics and contribute to dehydration. Footwear should not be overlooked. Shoes with firm soles, good arch support, and non-slip treads can dramatically enhance stability. Avoid flip-flops, loose slippers, or worn-out sneakers, all of which can increase the risk of tripping or slipping. In some cases, orthotic inserts prescribed by a podiatrist can correct gait imbalances and improve alignment. It's also worth conducting a home safety audit. Most falls occur in the home, so installing grab bars, securing rugs, adding nightlights, and removing clutter are simple changes that yield big benefits. Consider having a physical therapist or occupational therapist walk through your living space to identify hidden hazards and suggest modifications tailored to your unique needs. Vision and hearing should also be regularly checked. As discussed earlier, these senses are critical to maintaining balance. Keep prescriptions up to date, use proper lighting throughout the home, and consider assistive devices if necessary. For those who wear bifocals or progressive lenses, be mindful of how they affect depth perception, particularly when walking outdoors or going downstairs. If you experience recurring dizziness, lightheadedness, or falls, do not ignore these symptoms. Seek a comprehensive evaluation that includes a review of medications, cardiovascular health, vestibular function, and nerve conduction. Many communities offer balance screening clinics for seniors, a proactive step that could uncover correctable problems before a fall occurs. Perhaps most importantly, cultivate a mindset of empowerment rather than fear. Many seniors avoid movement out of concern for falling, not realizing that this very avoidance accelerates muscle loss, weakens coordination, and increases fall risk. Movement is medicine. Every safe step you take, every exercise you complete, every healthy meal you eat reinforces your body's ability to function with strength and stability. Surround yourself with support. Join a local senior fitness class, find a walking buddy, or consult with a wellness coach. Recovery and maintenance of balance after 60 is not only possible, it's achievable, and it can be life-changing. Balance is more than the absence of falls, it's the presence of strength, control, and trust in your body. Whether you're rebuilding it after a scare or maintaining it as a daily practice, the steps you take today can ensure you keep living the life you love on your own 2 feet.